How do GGDI's programs ensure inclusivity for marginalized or underrepresented women?
Just developing the system that people have access to care regardless, if you can. I think about so I live in not really a small city. Well, I guess it is a small city. It's about 110,000 people. So it's not like ginormous, but our whole region, I think, is something like 250,000 people or something like with all of our communities. But if you think our center's big, but there's so many people out in the outer skirts, it's just to make sure that, that they have access to telemedicine or for travel. Like we're very fortunate in Ontario. Like my husband couldn't get a rheumatologist here. So we traveled to Southern Ontario to see his rheumatologist and where he gets his care. And we have what's called the Northern Travel Grant. So in our province, if you can't access care in your region, the government will pay for your travel and your accommodations for you to receive care elsewhere. So making sure that, those kind of systems keep up with the cost of living so that people, and maybe speed up the payment plan. So instead of, having to wait 8 to 12 weeks to get your return back, maybe having a turnaround faster because having the system upgraded so that, because when you already have your health compromised, sometimes you can't work, right? So you're on disability, so you have less money. So you have less money to do that travel to access care. And so just making sure that we, look at where the holes are in the system and making sure that everybody, regardless of where they live, have access to the care that they need.